but the plans are still designed around sick care much more than they are around health and wellness. Even some of the corporate wellness programs are just okay with regard to that. A lot of interesting things. What have you seen with regard to the the corporate world in terms of care and the expectations and the challenges that they're facing?
Yeah. I mean, there's so much in there, Bill. So much. It's an interesting thing. I would say certainly pandemic related. I've seen a lot of focus on mental health and mental health programs, which is great. And I think, that's kind of the start of it. Like that there's so much relation between your mental health and your physical health. Like if you are really stressed, that is affecting things. That also you might, that's when you don't eat well. That's when you might not exercise. So I think that's a really interesting place to start. When you were describing this though, my first thought was, what's JP Morgan doing for the health of the employees? Because it's not about the health plan. I was thinking about this as, okay, I live in Seattle and we all know what Seattle's like. People are outdoorsy and, running all the time. But it is since the pandemic has started, every time you go to the wilderness, there are so many people there because there's nothing else to do. And also because people have more time. They're not commuting to work. And so, I thought about this like lifestyle change that, I mean, it's not a complete change because we were already pretty healthy and active out here, but work has shifted to allow people to live more healthfully, and they're also eating at home. So they're not eating out as much. So I have this question around, it's one thing for the employers to say the health plans aren't giving us what we need, but what are the employers doing to start with to encourage a more active lifestyle for people? I was thinking back, years and years ago, when I used to work at Microsoft, we moved into a brand new building, and the building had gigantic stairwells. Like I can't describe, like they were as wide as a whole room, and they were painted with murals. And the whole point was, don't take the elevator. And it was a 5-story building, and most people took the stairs because the stairs were actually pleasant. And I have gotten myself into trouble so many times in office buildings where I tried to take the stairs and then I'm like, getting spit out into a parking garage because all the doors are locked. So that's my first question. Like, what is the work environment doing to encourage people to be healthy and not, necessarily sitting in front of a computer all day, and more time to get out and even just, walking up the stairs in the building? And then the second is, this question around, do doctors really need all that data, especially if somebody is healthy? So, I kind of go back and forth on this, we need tech from a tech standpoint. We need to make sense of the data. We can't just be, I remember, when I first started in digital health and Fitbits were all hot, and people, especially in Seattle, because we're all fit, were walking into their doctor's office going, here's all my Fitbit data. And the doctor's like, that's nice. Like, what do I do with this data? And I think that's where the things become interesting is, what are your goals and what are the anomalies in this data, or what can we learn from this data? Not just like, here's all this data you're tracking 24/7 and then what? And then, going back to my previous point, like medical schools aren't training doctors to do wellness care. So there's a whole bunch of stuff that has to shift. And then there's this question of like, I've seen the data as well about, do wellness plans and employers work? So there's so many components. And I do agree that the offerings, first of all, when you're choosing a health plan, like you can't even tell, like you just want to be able to say, this is me and this is what's important. And there's no plan that enables you to do that. So that might be the first step.